Well, we'll call this meeting to order of the HHS, May 6th, 2021. I think Mike or Courtney will do the roll call now.
Yep, we'll start with Chair Brown.
Don Brown, attending remotely, Washington Township, Macomb County, Michigan.
Committee Chair Zinner.
Commissioner Barb Zinner, remotely from Harrison Township, Michigan, Macomb County. Thank you.
Commissioner Kleinfeld.
Veronica Kleinfeld, voting remotely from East Point, Macomb County, Michigan.
Commissioner Romano.
Commissioner Romano, District 4, Sterling Heights, present and participating remotely in Macomb County, Michigan.
Commissioner Kraft.
Commissioner Phil Kraft, attending remotely in Chesterfield Township, Macomb County, Michigan.
Commissioner Haw.
Commissioner Haw, attending remotely, Roseville, Macomb County, Michigan.
Commissioner Wallace.
Commissioner Wallace, attending remotely from Mount Clemens, Macomb County, Michigan.
Commissioner Song.
Commissioner Song, attending remotely from Warren, Macomb County, Michigan.
Commissioner Van Sickle.
Commissioner Van Sickle, attending remotely from Sterling Heights, Macomb County, Michigan.
Commissioner Matuzik.
Commissioner Matuzik, attending remotely, Clinton Township, Macomb County, Michigan.
Commissioner Farrington.
Commissioner Farrington, attending remotely from Utica, Macomb County, Michigan.
Commissioner Sabatini.
Commissioner Sabatini, attending remotely from Macomb Township, Macomb County, Michigan.
And Commissioner Nard.
Commissioner Nard, attending remotely from Warren, Macomb County, Michigan.
And that completes the roll.
Thank you. I think we will now stand for the pledge, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. We'll go to adoption of the agenda.
Romano will adopt the agenda.
Thank you. Are there any questions? Any discussion? Shall we vote then?
Commissioner Song, I think we're having a connection issue and we can work with that with staff. Could you just verbally vote yes or no?
Commissioner Song votes yes.
That motion passes 13-0.
Thank you. We'll go to the approval of the minutes. Is there a motion?
Motion to approve by Nard.
Support Sabatini.
Is there any discussion? We'll go to a vote. Thank you.
Commissioner Song votes yes.
All right, we will go to public participation. Do we have anyone here, do we know, at this time?
Chair, we do not have anyone in the chat box listed, and there doesn't appear to be anyone on the phone.
Is there anyone for public participation? Is there anyone for public participation? Nobody showing up at all? Okay, then we'll go to presentations, please.
Commissioner Song makes a motion to receive and file.
Thank you.
Support by Nard.
We will go to Martha T. Berry and the director, Kevin Evans. Hi, Kevin.
Hi, thank you, Madam Chair. Thank you, commissioners. I believe I am going to be presenting. If you'll give me just a second to select the correct one.
Okay.
Can you see our tree?
Yes.
Very good. Thank you. Well, I appreciate the time that you're taking. I understand that there's a lot going on, so I'll try and be as quick as possible here. We'll start with trying to figure out why this isn't advancing here. Here's our slideshow. And let's do it this way. All right. So today I do want to do a brief summary for people that aren't familiar with Martha T. Berry. That'll only take a minute. 3 minutes on a COVID update. People want to know about vaccinations and visitations. We'll be talking about our quality position and our efforts as it relates to quality and service to our elders here. We'll talk a little bit about financial status as well. Some wonderful cooperation from the county as it relates to the COVID expenses and our hopes for the next 3 years. And then we'll have a couple of minutes for questions if you'd like to do that. Oh, first, who we are. We are the social safety net for those that are medically frail and don't have the ability to pay. If you take a look, we did this a couple of years ago, just looked at where most of our referrals are coming from. And the majority of them are coming from other long-term care facilities because they aren't able to care for those that don't have the ability to pay. The Medicaid program pays county medical care facilities just a little bit more. And we are the ones that provide after the Medicare programs have expired in many cases and the residents don't have the ability to pay. It's an important thing to note that we only have we have 32 facilities for 88 counties. So we're a small number of the 440 some facilities in the state, but it's an important piece to note that we are that safety net when people don't have any place else to go. Vaccinations and visitations. We have roughly 25% of our staff vaccinated and 81% of our residents. Now, according to the national averages, we're a little bit under from the staff and we're over for our residents. Because we are a government entity, we may not mandate unless the federal government makes that requirement. We continue to educate, by the way. We have an inter-facility 2 channels, one for our staff and one for our residents, and we're constantly showing different approaches, including some of the celebrities saying, please get vaccinated. We're putting pamphlets out, encouraging them to get vaccinated. So we have, we're hoping that the staff will continue. That's been just a slow creep, just a few at a time. Once we have our pharmacy in our building, they let us know that if we have an odd number of individuals, that we can ask our staff if they want to get vaccinated here. Again, I'm sure many of you know we can only vaccinate in groups of 5 because the vials are very precious and they do not want to waste any doses. So we're working through that program. Pleased to say that the health department is giving us a stopgap. They'll be here on the 11th to vaccinate our residents that missed vaccinations and desire to get their finished doses or to be vaccinated for the first time. Visitations, as we talked about last month, what had happened was we had a spike in our community where we had over 20% positivity rate, and we had to be a lot more restrictive. However, CMS and CDC are recognizing that with the majority of our residents being vaccinated, that the risk is lower. There are far fewer seniors, especially seniors in long-term care, that are getting the virus, and if they are, they have no symptoms. So right now we have families have the ability to visit in our celebration center. We schedule those visits right now and keep it in an area that's a very large room, so there's a lot of social distancing there. And we hope to be able to allow them to visit in their loved ones' rooms when our positivity rate in the county drops below 10%. We received some good information for our residents in that the schools will not be required to have testing done for their students to participate in sports. So I expect to see a significant drop in the positivity rate when that occurs, because our positivity rate goes down when you have less testing. I know that is counterintuitive for many folks, but you know, if you think about it, the only people that have been testing are the ones that are in the hospitals with symptoms, and those facilities that are required by rule, which essentially are long-term care facilities, to test weekly, sometimes twice a week. So we know that the variants are in and around, and they are not as, even though they spread easier, they're not as virulent in terms of the illnesses. It doesn't mean to say we're out of the woods yet. We did have one staff member go to the hospital out of the 38 that we had so far this year that tested positive, but the vast majority have been, and I mean, when I say vast majority, I mean 31 of them were asymptomatic. 6 of them had mild symptoms, and the ones in the hospital. So we see that that we're heading in the right direction on the virus, and that allows us to have visitations a little bit more open each time. Our staff still is vigilant on what's called source control. It's a fancy way of saying they're wearing really good masks. We have KN95s that we have, and again, that's in great participation with the county to help us with procurement. Quality, 5-star system is rated on several factors. The most significant is the health surveys. The lower number is better, and those are the cut points there. I won't get into that, but if you take a look at that number right there, 190.17, right now we are at 190.20, which puts it as a 1-star. We are 3/100ths of a point to go to a 2-star on our health survey visits. We're expecting the survey teams to come in for the annual pretty soon, and we have great expectation that we'll be moving up in the quality rankings. Just so you know, in 2016, we had 380 points. Higher numbers there are worse. So we've made great strides over the last several years, and it takes several years for citations to drop off of this rating. So we're looking hopefully this year to be able to get into a 3-star. We are currently at a 2-star overall rating. Let's talk a little bit about finances. For some of you that are new, you may not be aware that the county for many, many years had something called OPEB, or other post-employment benefits. That is employee health care. This was stopped back in 2012 for our organization, but it still had, we have about 43 people that are eligible. The county at the time was trying to kind of smooth the costs and put a bond out for OPEB, and it was well intentioned, but we have a different reimbursement mechanism where on a cost base versus an appropriations budget. So what happened was we were able to only bill for 3 years instead of for 20 years but we incurred 5% of a debt, or essentially $6 million in interest in that debt. Again, it was well intentioned, and the unintended negative consequence meant that we couldn't do additional billing for that. We're still trying to find ways that we can do that with the state, but right now we've not had any success. But the positive consequence was we received some money that allowed us to invest in required service expansion. So our celebration center, which did not exist except for just prior to the COVID, didn't exist there. And some of our dining services that were critical as we moved in through COVID, the timing was outstanding. So really pleased with some of the expansions. We also did some infrastructure changes that helped with our piping, our plumbing, our water systems, and some of the electrical. I know I'm speaking quickly, so I'm sorry about that. What happened though with this, just so you're aware, we have an estimated annual liability for the next 20 years roughly of OPEB of $1.3 million every year. We have a construction bond repayment of $1,069. You may have heard it called building use. That's done with an agreement in 2022. So right now, our total minimum legacy expense is almost $2.4 million on a budget of right around 30 million, which is pretty significant. Our cash position, however, remains strong, actually better than when we started COVID, in large part thanks to the efforts of a number of people. I credit the Emergency Operations Center with Macomb, the treasurer, and also the finance department for helping us get supported for our facility through the tranches of money that has come into the county directly. We've also done some additional billing to get reimbursed for testing of our staff and our residents. So we're actually at 3.5 million in the bank, which is better than we started in 2020. Now we still have additional costs on that, and our census is low, but our team has managed aggressively to make sure that we are being good stewards, even though we dropped significantly in census. I'm also proud to say that facilities are still turning to us because they recognize that we're a facility of choice when it comes to individuals that have no place else to go. So we still are, even though our census is lower than what we would like it to be, I'm pleased to say that we're consistently 10 to 15% higher than our county and state average in terms of census because of the unique nature of our business model. And I think I already mentioned this, but I want to say thank you again to Macomb County. The entire county, many departments have been a true partner in keeping us safe. They recognize that our seniors are the most vulnerable. And once we got going and we had systems in place, they have been just incredibly helpful in reimbursing expenses for social distancing, leveraging purchasing for us, and so much more. Just a great appreciation for what's happened at the county. So now we're hoping for the new tranches when the money comes in. We're hoping for ongoing hero pay. We know that the county is going to be getting some money coming in directly, and we're setting up, going to be making some requests that as we continue on for our facility, what are some of the important things that we can do? We know that the money is, if the money is available, we'd like to update our HVAC systems with new HEPA and green compliant technology and enhanced surveillance technology that tests temps for people even coming into the door, that we don't have to have a person manually, pointing what looks to be a laser gun at them. So we have some small expenses on social distancing equipment for offices that we're looking for too. So those are our hopes for the future, and we're in communication with the county proper on that. I know I went through that quickly, but I know we have a large agenda. Does anyone have any questions?
Commissioner Kleinfeld?
Thank you, Chair. Kevin, the 9% of residents that haven't been vaccinated, is that by choice, turnover, a combination of the two, or is there another factor?
Thanks for asking, Commissioner. There's a couple of factors in there. A couple of them are based on religious beliefs. Others, we have one that has several of our residents that has guardianship over a number of them. And it is, we're actually in communication with this individual because we believe that it's her wish and her belief system that is causing her not to have any of her those under her care to be vaccinated. So we sent a letter out to her just saying the new rules allow more social distancing or more socialization and being able to actually eat at the same table with their friends without a mask on. if they're fully vaccinated. Those are things that really impact the residents' lives, and we'd like her to reconsider that.
So, the percentage of staff that's been vaccinated, it's concerning to me because I was on the East Point City Council meeting Tuesday night, and Harvey Curley has COVID. Those of you that know him, he's in his 80s. And I have to tell you, he was in rough shape, and he was vaccinated a couple months ago. And I think if he wasn't vaccinated, I don't think he'd be with us right now. And I get that people have a right to choose not to be vaccinated. I don't know that they have a right to work with the most frailest people in society. That's my personal opinion, obviously, but I just think there are certain career fields that you choose. You have responsibilities that go along with that. And that's a very low percentage. People that want to be vaccinated, most of them have had the opportunity. So I'm disheartened by that percentage. And those individuals, as you said, are getting hero pay, correct? They're getting extra pay because of COVID, but they're not getting vaccinated to protect the residents.
That's correct. We've had a number of conversations with our attorneys about what are the right ways, what can we wade into and what can we not wade into as it relates to incentivizing people to get the vaccination. However, recognize that we have a number of different perspectives based on a number of different cultures that have an understandable fear based on history. And we need to overcome that with good communication and ongoing consistent communication. And also the fact that I've taken it and I've not died. That's a pretty good way of letting them know that, that I'm healthy and I've taken it and I'm leading in that responsibility. However, you are correct in that it's disheartening to see half of the state is vaccinated, but long-term care, not just my facility, but many have the same challenges. Now, the good news is—
I absolutely understand the history, but in that history, the medical procedures and experiments and things that were taking place with only one section of the population. They weren't taking place with everybody. It's the reason that the things that happened. And this is a situation where everybody is being asked to be vaccinated. So we can't be zeroing in on one population and doing something nefarious. Well, I mean, there may be there actually isn't a possibility with our system because you're making an appointment, you're walking in, they can't switch vials and things. So people that have been vaccinated can still get COVID. My daughter's father-in-law got it after he was vaccinated for a couple of months. I do believe it would have been a lot worse. It's just disheartening. I think we do have a right to say we don't have to put something in our body. I just don't think we have a right to choose where we work. What if people in the operating room decided, well, I don't want to wear a mask and gloves because I don't believe in them?
Right. So
I don't understand why we treat this differently. I'm getting off of my soapbox and letting others speak. Thank you.
All right. Well, I'll respond to that just a little bit. The good news about that is we have tremendous source control. Many facilities are using the surgical masks. We use KN95s, and that's where the majority of the risk is in breathing. All right. So those droplets that come out as individuals breathe, we give them packets that they can take home with them for family packs, we call them, for PPE, and they get a new mask every day here. So we work diligently on that. We give them hand sanitizers when we have an extra stock. We just did that this last weekend. So for them to take home, but we also have that all over the place here. So we are incredibly vigilant on making sure that if somebody is, and we also are testing everybody twice a week right now. So we're incredibly vigilant on making sure that if they do contract the virus, that we're safe while we're doing that when we get them out of here as soon as we do the rapid test. We have Binax Now tests that are are way more accurate than they were just 6 months ago, and we'll know within 15 minutes and get somebody out of the building. So we have a lot of ways to keep the residents safe. But I would like to see more people vaccinated. I'm with you, Commissioner.
Thank you, Chair.
Thank you. Commissioner Sabatini.
Thank you, Chair. Good afternoon, Kevin. Good to see you. Thank you for the report. Just looking at the numbers, really satisfied with the cash at hand. Great improvement. I know we struggled with that in the past, and my only question is in regards to that, with having so much cash on hand. Now that you've attained that, that's wonderful. Is the treasurer helping at all in investing some of that money, or is that just sitting in the bank? I know, I'm sure you'd like to get some interest or have that money work for you in any way it possibly can. I'm just curious.
Well, thank you for the question. Right now we are going to be paying down some of our debt to the county. So some of that money is earmarked to go back to the county for our building use and our OPEB. The treasurer has been helpful in getting us timely money from the millage. That's one of the reasons why we had a little bit more here, is that we had worked with this commission on lots of ideas as to how we could overcome the bottleneck that we were coming to right now. Nobody expected COVID, but we did have issue a millage, a 0.1 mil millage for 1 year to help us with repay us for some of those required building improvements and service improvements that we needed to do. So recognize that right now we have less than 2 months available to us. And if you're looking at a AAA bonded facility, they want 6 to 8 months in liquid cash, and we don't have that right now. So, and since we're still in an unstable time, I don't want to lock things up. The treasurer's office has been very welcoming on recommending that when we have money that we're able to set aside, we will do that and do some investing. But I'm just not confident that right now is the time.
Okay, great. Thank you so much. Thank you, Madam Chair.
Thank you, sir. Commissioner Brown.
Thank you, Madam Chairwoman. Kevin, what's the current occupancy rate of our facility right now?
Right now,
By percentage.
We are at 85% right now.
Okay, that's pretty good. Has your facility, has that number been steady, or is it a decrease or an increase?
Well, we are low steady right now. We got down to roughly 75%, which is below what Medicaid requires of us, but they have a waiver statewide. When you hit when you drop below certain thresholds, they dramatically change how they pay for you, but they've waived that until we get, as a state, we get our censuses back up. So we have been pretty consistent right around there. We are best at when we're at 92%, and we really are financially strong. We're at 95%, and we were there for probably a year and a half at 95% to 98% just before COVID hit. I expect us to get back there once we are able to transition people into the facility without requiring a private room. Right now,
what is the impact of the lower numbers though over the last year? How significant is that to your bottom line?
Well, that's roughly $2.8 million lost opportunity from the census alone. But again, thanks to the work that the commission did in reimbursing us for, those changes that we had with the millage, and then also with the county, with the tranches of money that has come in, we're still very solid. We're also managing the expectations too. We haven't laid anybody off, but we are managing our labor pretty significantly, and we're doing only COVID-based additional expenses. We're not doing a lot of the extra stuff that we'd like to be able to do.
Speaking of extra stuff, the capital request that you mentioned earlier, what is the total dollar value of the capital request you'd like to see, and what are wants and what are needs?
Yeah, I'll be putting that all in a report, Mr.
Okay.
Chair.
Well,
Right
maybe
now,
we'll hold off on that for a future discussion then.
Yes,
But
sir.
I'd be curious to know what that is specifically and what you truly need and what you'd like to have. So thank you, Madam Chairwoman. Appreciate it. Thank you, Kevin, for your report.
Thank you, sir.
Thank you. Commissioner Van Sickle?
Thank you, Chair. Good afternoon, Kevin.
Good afternoon.
Since you're at 85% occupancy, I assume you have no waiting list.
That is correct. Well, actually, we actually had a small waiting list because we only had a certain number of rooms that we had private pay. We are now starting to be able to cohort, but we had 4 people on the waiting list because we didn't have enough private rooms to bring people into.
And so they've been satisfied now?
Yes. Mm-hmm.
Okay, before COVID, what kind of occupancy did you generally run, and what kind of waiting list was there generally?
We ran 95 to 98% right up until before COVID came, and I'm pleased to say that that our team really manages well. If our waiting lists are usually taken care of right away, so we'd have 1 or 2 people on, and then we would manage with them. We looked to make one of the things that we do is we're unusual in that if somebody needs services, we actually look for a place where they can go as well, because we've always been such a high census. We want to make sure service is delivered, and we'll be of value to anybody regardless. So our team works great with other nursing facilities in the community.
Great, thank you very much. Thank you, Chair.
Everybody looks to be good. I don't see anybody else that wants to speak. I would just say that I know many, if not all of you, think that everybody should be vaccinated. But as this point, which is happening now, where people are seeing the double vaccinated people, people are getting COVID. There's several people. I mean, my husband and I each know people who have gotten COVID after being fully vaccinated, and I know there are many people that are very concerned about it. If they're getting sick after the vaccinations, they were concerned before, and they're still concerned, even more concerned. So it's a factual concern to those people. And as Kevin has said before, his workers have been very loyal, and they've been very good to the citizens, the patients there in the facility. He lost a couple people for their reasons, but these have been loyal workers, and it's hard to find people like that. I think that's a valuable, I want to say, commodity to be able to keep. So, Kevin, do you have anything else you want to finish up with?
I just would like to thank the commissioners. Your support has been tremendous throughout the years, even with difficult discussions. It has been respectful, and I so appreciate the support. Even now, it has. I just really appreciate the engagement that this commission has and the focus that you have on seniors and those that are most vulnerable. I'm most grateful. So thank you, everyone.
Thank you very much, Kevin. And I think we will take a vote now.
That motion passes 13-0.
Thank you, everyone. Thank you.
I think we're now going to move on to Veteran Services. Director Laura Rios.
Madam Chair, I'll make a motion.
Oh, I'm sorry. Do I have a motion for receive and file?
Yeah, Farrington, receive and file.
I'll second.
Support.
Thank you. Hi, Laura. Would you like to,
Can you hear me?
Yes, yes.
Okay, great. So you already have the quarterly, I call it the quarterly report. There's just a couple things I want to update you that's not on the quarterly report. Do let your constituents know that we are offering free dental cleanings, x-rays, and exams. We're doing it 3 times this year. It's for uninsured veterans. So if the veteran's 100% service-connected disabled, he gets dental at the VA. This is I'm using my grant money from MVAA, the Michigan Veterans Affairs in Lansing. I'm using some of that grant money because it was so successful last year. We just did one, I want to say it was in February, and it was not successful. We have 16 slots. We had a long waiting list last year. We had like 6 people there. So 2 no-shows. So if you know veterans, especially seniors, there's a lot of seniors that don't have dental. If they're uninsured and they don't have dental insurance and they are honorably discharged veteran, they just contact our office and we will walk them through the steps, because we're partnering with MyCare and Centerline, and they want all of their paperwork filled out ahead of time and faxed to them, or emailed to them basically like 3 or 4 days before. So they know all the patients and have all the information already done. The second thing is since Kevin was on the line talking about Martha T-Berry, I did get to go take all of my collaborative to our new veterans home in Chesterfield. So they did the ribbon cutting ceremony. It was a very small event, although the governor was there. And then I did arrange a week or so ago to get some of my collaborative partners like the VA and some of the home care agencies that we work with to do a tour. So if you do get an opportunity to do a tour, you want to do a tour. This facility is not set up like any nursing home. Every room is a Medicaid bed and every room is a private room with their own bathroom. Also, every room is geared or has the equipment for bariatric or Hoya, the Hoya lifts. So the one nurse who gave me the tour basically said she came from the UP Veterans Home. They had one lift for the whole entire building. Here, every room can be equipped with the lift. So that's a lot. They really thought everything. You wave your hand in front of a sensor to go in and out of the bathroom. You don't even touch anything. So just checking in, they have a little kiosk, and it takes the kiosk takes your temperature. It records your name. It asks you the 5 questions of, have you been exposed? Do you know anybody? Have you tested positive? It has all those things. And that's just right at the kiosk when you walk in the door. So if you do want to do a tour, let me know. Because they are not going to do tours after the 17th, which is the first day the veterans move in. And the other thing is, when you talk to your constituents and your folks in your area, it is a good 2-week process. So it's a 20-page application, goes through a process to see if they're eligible, if they can take care of them, because it is nursing care. They do have OT and PT there. But there's so many things that have to be, worked and approved before that resident can even move in, or that veteran can even move in. So when I talked with them a couple weeks ago, they had 30 applications, and they review the applications every Friday. And it takes 8 hours to review 30 of them because of all the teams of doctors and nurses to see if they're equipped to handle, what the patients, what the needs of the patients are. So I wanted to bring that up. And then on my report, you will notice that the federal burials are about the same. County burials have almost doubled. Our trust fund and relief fund is still down, which is our emergent need grant. those numbers are still down because there's ample amount of funds still available. And we ask them to exhaust all other funds before they come to us. But a lot of people are still on unemployment. So the emergent need isn't there until that cuts them off. So other than that, I'm hoping to do some outreaches this year. I'm hoping, you know, some of these outside events might happen so we can do some outreach in the community to let veterans know about their benefits. So other than that, and then I did pay for media, and our media campaign runs in August. We did discuss that last year, but our media campaign, which is going to be your TVs, your bulletin boards, and all of that, that runs in August for about a month. So any questions?
Laura, I just want to know how you get all of your energy, all the things you do.
Oh, tax season's not even over. It got extended, which really ticked me off, but hey, I roll with it. So
yeah, we really appreciate all the things you do for the veterans and the other citizens in Macomb County. Thank you so much.
Oh, you're welcome.
I think everybody's good. You're very good, and you know everything you do is always good. I think we're going to go for a vote now, and thank you very much, Laura.
Oh, you're welcome.
That motion passes unanimously.
Thank you, Laura. We'll go to department recommendations, and we will go to the budget amendment from Macomb Action. Ernest, and you're there. I think I see your name. Hi, Ernest.
Hello. Yeah, we have a few of them here for you today. This first one is a pretty straightforward one.
Chair, I'm sorry, can I make a motion?
Forward to full board first.
This is Commissioner Song.
Commissioner Hossack.
Thank you. Sorry, Ernest.
Yeah. This one is based upon reimbursement. So it says $200,000 from DTE and consumers. The reason it's not differentiating out is this is a rebate program. As you can see in the backup documentation, the energy companies give us a variety of rebates when we install a new fridge, a freezer, or a furnace, or a water heater. And so we have utilized the existing budget. And so they had told us that they would give us additional allocations to continue the rebate program. And so this will be determined on actual reimbursements based upon those different items of equipment that we put in. And so it really depends on what we're installing as far as who will contribute the most and where it will come from and what the actual amounts will be. But I can say it's a great program, and it really helps us put extra energy saving equipment into people's homes.
Barb, you're muted.
I think we'll go for a vote. I don't see anybody wanting to speak, so we'll vote now. Yes, we will vote now on this. Is there any discussion?
That motion passes 12-0.
All right, we'll go to B, the Children's and Family Division Food Assistance Program. Motion for forward to full board.
Moved by Kleinfeld.
Support by
Support Van Sickle.
All right, Ernest, do you want to speak about
Yeah,
this?
absolutely. This is one that's a theme at MCA. You know, we have a range of existing state and federal grants And because of our high performance on them, our good program quality, and our useful stewardship of the budgets that they give us, occasionally we did not have to apply for this. They reach out to us and notify us of additional funding based upon our formula and volumes. So this is some more funding for the Emergency Food Assistance Program, which we operate out of our food warehouse along with the USDA programs. So this additional funding, while it's a small amount compared to the larger amount we receive, it's useful because we have a lot of food funding, and this funding cannot be used for food funding. So we'll help use this for all of our warehouse operations, our material supplies, and management of the food warehouse.
Good. We'll take a vote.
That motion passes 12-0.
Thank you. We had thought about putting some of these together, but we weren't able to. We'll go to C, Children and Family Division Water Residence Assistant. Ernest?
Yeah, are you ready for my comment here?
Chair, I'll make a motion to forward to full board.
I'm sorry.
Support Romano.
Thank you. My thing moved. Thank you, Ernest. Go ahead now.
This is an interesting one. I don't know how many of you are familiar with the Great Lakes Water Authority or the Water Residential Assistance Program. This funding is funding that we've utilized in years past since the inception. However, previously it was operated under a consortium between Wayne Metropolitan Community Action Agency, the Oakland Livingston Community Action Agency, and Macomb Community Action Agency. And Wayne Metro was the administrator of the funds. They are just at the first phase of reviewing and evaluating the Water Residential Assistance Program. And one of the things coming out of that is they are going to award the Great Lakes Water Authority funding to each region directly. So this funding is funding that we've operated in the past through our water conservation efforts and our water repair efforts. But in previous years, this didn't always come to the board because it was run through the fiduciary of Wayne Metropolitan Community Action. We're looking forward to the evaluation by public sector consultants in Lansing of the Great Lakes Water Authority RAP program. And one of the dynamics you should note at play here currently is both at the federal and the state level, there are many bills looking at providing water-related assistance. We are in a stronger position because we already have the Great Lakes Water Authority RAP program. Hopefully, when we see a lot of the federal and state assistance coming down for water assistance, it's something that we will be able to say, we already offer similar services through our Great Lakes Water Authority program, and we are able to then use this for other items that are more discretionary. Specifically, we're looking at things like well water for northern rural Macomb residents. You know, we have a variety of funding sources to provide in-home water repair, to provide repair for plumbing leaks and fixtures and faucets, and that's what we have always done through the RAP program. But it is an important dynamic to note. If you hear about federal funding coming down the pike or state funding, there are a lot of sources looking at providing programs just like the Water Residential Assistance Program provides. And it is our hope, and we're already pushing and advocating, lobbying at both the state and federal level, that they include some flexibility in eligible allowances. So if that formula funding comes to Macomb, because we already have a strong and established RAP program through the Great Lakes Water Authority, hopefully we'll have some flexibility to be creative and utilize it for complementary services beyond just RAP. But that is what we're doing with this, is bringing this on over to Macomb County, and that will be going back out to another contract bid in July, and that's when the full funding will come directly to the county instead of going through Wayne County.
Thank you. Commissioner Brown?
Thank you. Thank you, Ernest. Can you explain where the money comes from through RAP for the commissioners that may not be aware of it?
Yeah.
Where that money originates from?
Absolutely. So Great Lakes Water Authority services many of our communities. Not all of them. Some only for water, some for water and sewer. But they're a major player in our region. And Brian Baker from the the Public Works Office with Candace Miller, sits on the Great Lakes Water Authority Board. They have government representatives from each of the counties they serve, and this comes directly from the Great Lakes Water Authority. This is similar to the initial grant I put in front of you from Consumers and DTE and the Public Service Commission. They have profits generated from the utility companies across the state that are put back into community service, and Great Lakes Water Authority chose to structure a RAP program in their service area to help benefit clients who are behind on their water bill. So this is primarily utilized when a resident is behind on their water bill to help both bring them back out of arrearages, give them a monthly subsidy, enroll them on an affordable payment program, and help remediate any wastewater usage they may have, whether it's leaky fixtures or faucets or plumbing repairs that are needed. So it's contributed by Great Lakes right back to their consumers.
It's funded by the ratepayers.
Yes, well,
it's
yes,
built into the rates. So the rates that we all pay for water and sewer in an area, a portion of our rate goes into a fund that funds this. So and that takes care of the people that are having difficulties paying their bills.
Yes, sir.
And I'm glad that I'm encouraged here about the well assistance for the northern communities. You know, I'm on a well, and sometimes it gets frozen over in cold days, and I don't have any water. So, you know,
that's exactly right, Commissioner Brown, and that's what we've been saying. Is this funds people that are already connected? We want to be able to be in a position to do something creative, help those low-income rural clients that often don't have any assistance. So, it's not they're not mentioned yet, but that's what we keep advocating for: is that communities like ours that already have RAP funding should be able to do something different for residents.
Very good. Thank you, Ernest. Thanks for explaining that a little bit, but important that people understand. There was some controversy about that when it was set up. And it's good to see the Macomb County receiving their portion of it and being put to good use. So thank you again.
It's a great point, Commissioner Brown. And as always, as with the DTE and consumer programs, they say that it's their generosity contributing it, and it is, but obviously it is the ratepayers. And that is where the Michigan Public Service Commission always comes in and make sure that they're regulating any use of the ratepayers' funds.
Thank you, Madam Chairwoman.
Thank you. Commissioner Kraft.
Thank you, Madam Chair. Ernest, real quick, on our recommendation sheet under the section where it says benefits, who and how, it says low-income residents of Macomb, St. Clair, and Lapeer counties. So is Macomb Community Action, are we working with St. Clair and Lapeer folks to facilitate that, or is our staff going to be helping those counties do that?
In times we have helped other areas. For instance, right now in Oakland County, they are having a shortage of skilled trade staff that can do conservation water repairs, and they've asked us to help with that area. In the past, we have also provided contractual services or through our vendor network, which oftentimes it's not actually Macomb Community Action staff. It's through our range of vendors that we may help them and send them out there. But it will all be determined on their capacity in their local region. But we are always happy to support at Macomb Community Action any of our partners in those service areas. I think the big thing to know there, Commissioner Kraft, is there is actually a large shortage of skilled trade workers, specifically for water programs and for housing weatherization. So Macomb Community Action has part of its excellence and part of its strength in the capacity and quality of our contractor networks. And that is something that has really benefited us, and a lot of the state recognizes that we have a strong network of quality contractors.
Got it. Thank you, Ernest. Thank you, Madam Chair.
Okay, can we take a vote now? Are there any questions? Are there any? If not, can we take a vote, please? Thank you.
That motion passes 13-0.
Thank you. Next, we'll go to 7D, budget administration for the action for children and family division for food program management for $50,000. Oh, I need a motion to move to full board.
Motion to move to full board, Nard.
Support, Farrington.
Thank you. Ernest?
Yeah, this is another one for our food program. You may know that there's a related Macomb food program nonprofit that is set up to support our food pantries across the county. They help with the letter carriers food drive and a lot of those operations. And that nonprofit is a supporter of Macomb Community Action's food pantry operations. And they have a separate board that helps operate and support our food program efforts. And historically, depending on our needs, they contribute some of their fundraising to support the Macomb food program through Macomb Community Action. So this $50,000, again, it's not to be spent on food, because we've had a lot of assistance and we've had a lot of success with our USDA and TFAP funding programs to get funding for food. So this will also be used to support our warehouse operations with supplies, equipment, staffing, and management of the Macomb food program.
Commissioner Matusik?
Thank you, Chair. Hi, Ernest. I think you just answered the question. My question was, how does this one and the first one work together?
Yeah, that's exactly right. They're complementary. It's great to have this contribution as well, because there are always gaps in funding between the food and the shelving and the warehouse operations, the staffing and the management. You know, we also give stipends to our food pantries to help them complete operations. So this will be complementary and in very similar fashion to the first one from the Federal Emergency Food Assistance Program.
Thank you, Madam Chair.
Thank you. I think if there are no more questions, we'll go to a vote, please.
That motion passes 13-0.
Thank you. We're going to go to 7E regarding the CARES funds. Ernest, go ahead.
Madam Chair, I'll make the motion and refer to full board.
Thank you.
Support by Nard.
Next time I'll try to find some way we can group these so you can make less motions. For this one, this is related to an item that you had reviewed last time at your committee and full board, the annual plan that had both the community development block grant, the home funds, and the emergency solutions grant, the ESG. It was listed as an amount of $9.2 million when you reviewed it. This is to reconcile the unspent carry forward funds. We were really hit hard during the 2020 pandemic with in-home repairs. We didn't want to go in the homes for the client safety. The clients didn't want us in the home for both our safety. And there was a real time delay where we had jobs. When we get a job, we have to go out and evaluate it. We have to cost it out and get the approval, start the work, then we do quality control. And there were a variety of jobs that had already been approved, but we couldn't do any work in them. And there was an accumulating amount of jobs needing to go be assessed for approval, and we couldn't get in even to do the assessment. So unfortunately, due to the pandemic, we weren't spending these dollars at our usual rate. And that's really the reflection of this, is we couldn't get in the homes. Even once we were allowed to, there were some delays and hesitancy about getting back and completing that work. We started with exterior work. You should know that all of our staff, both wore personal protective equipment, would offer it to the home client if they didn't have it. We took health and safety to the highest standards there, but it still significantly delayed our spend on these home repair programs. So this is a carry forward that will be added to our current spend. And of course, this is not unique to Macomb County. Our neighboring counties, our neighboring states across the country, because of that dynamic, we're hopeful that they will allow this to be carried forward again. It's not that we were underspent and Wayne County could use it. It's across the nation. People were underspent with these in-home repair programs. And so we are hopeful that they will continue to extend this and we will get it deployed in Macomb County homes as we've done every year.
Thank you. Chair Brown?
Ernest, was there any money carried over from last budget cycle to this year?
I think there may have been as well. Usually they give this funding to us in a 2-year cycle itself, even though it's supposed to be spent in 1 year, they awarded in a 2-year. And so naturally we're managing multiple years. I think we might be managing 3 or 4 years of this funding at any given time.
But that's not reflected in this number, though. This number is new money.
The 4.2 is the carry forward that wasn't previously listed in the 9.2 of new funding that you would approve.
And we don't know yet whether this money will be allowed to be carried over if it's not spent properly.
That's correct. That's correct. We assume it will, but again, it's an uncertain time, and we're just trying to read the dynamics at play.
What can be done to help make sure this money's pushed out and spent properly? There's a lot of money in the system now, and people wanting to get access to it. But what are some of the drawbacks, or what are some of the? Is it about processing requests? Is it about having contractors to do the work? It's a lot of money, so I want to make sure it gets spent.
It's a great question, and those are the same questions we're looking at. You know, part of this is an issue of guidance for allowable expenses. We know how to spend this money in an average year. That's what we do every year. We know how the normal operations look. We have an excellent contractor network. We can hit the number of jobs we need in homes to get this money spent in the average year. However, you know, this money is also compounded by the coronavirus funding that came through with each of our funding sources. So the CDBG funding got a special allocation of CDBG funding. And then we got CARES funding. And so these sources are competing with each other. And we just had a call with HUD the other day, and we were looking at innovative proposals around the country. You know, one of them said, we're looking to install new UV sanitizers in HVAC units to protect senior centers and community centers from airborne coronavirus. And of course, that really excites us to have a new innovative opportunity for investment. You know, after that call, the HUD representative clarified that those were only proposed programs and they were not approved programs. And HUD, if you've interacted with HUD, they're a behemoth organization that takes a lot of deliberation to come down with conclusive guidance. And honestly, Commissioner Brown, that is one of our biggest challenges is a lot of this funding comes from HUD, and HUD really likes you to stick within the lines, and they draw very discrete boundaries for their guidelines. With this coronavirus funding, they haven't done that, and you have a lot of people promoting their innovative ideas. We were at a HUD-sponsored webinar where they told us about things like UV sanitizing in HVAC units. And on that same webinar, they said, you know, not so fast. We haven't formally approved these great innovative proposals yet, so don't plan on replicating them till we vet them for approval. So we know how to do what we know how to do. We know how to do the normal programs here. What would really help us in spending additional money is being able to use it for new and creative things that really respond to needs in the community. And so that's what we're doing now. Go ahead.
So you've got the same set of programs you had from previous years under normal circumstances. Now you got the same programs, the same number of programs, the same size of or number of programs, but you got twice as much money maybe, or a lot more money to fill the same needs. So it sounds like you got excess money that you don't know what to do with because you can't spend it for HUD guidelines.
We definitely have wait lists and capacity constraints. On any given year, if you give us more money, we'll be able to get it out because there's always excess demand beyond the funding. So most of this can easily be spent within our usual parameters by not having a wait list, but we do hope there's an opportunity to innovate, and we are waiting on that guideline.
So this will wipe out the wait list, hopefully.
Hopefully.
Okay, great. All right. Thank you. It's a problem of large money in the system right now. That it's a very unique problem for local government to have.
Yes, it is.
Thank you. Thank you, Madam Chairwoman.
Thank you. I think we will go to a vote now, please. Thank you, Mike. Or you're running it.
That motion passes unanimously.
Sabatini votes yes, having internet connections.
Okay. We're now going to go to 7F regarding equipment funding. Move to full board, please.
Motion to move to full board for NARD.
Support Hoff.
Thank you. Ernest?
This one is another straightforward one related to our current excellence and capacity with the senior service programs. This funding came to us from the Area Agency on Aging 1B. And as you can see, we have a pretty straightforward use for it. We're going to buy extra equipment that is used in the transit of our hot food programs. So Cambro, I know it's an unusual term if you don't know what it is. It's basically, a big refrigerator that's thermos. They're usually plastic, but they help keep hot things hot and cold things cold. So those double stacked Cambros on wheels, are just a big chest that keeps our things piping hot. It can be plugged in and help. And also the electric bags, which we use in transit for some of our Meals on Wheels. So we'll use that funding to make sure we have all the equipment that we need to get our hot food delivered hot and safely to our seniors.
I see no speakers, so I'll move for a vote, please. Thank you, Ernest.
Commissioner Sabatini, if you wanted to vote verbally. We may have lost him. So that motion passes unanimously.
Thank you, Mike. 7G, we will go into the relief supplements. Why don't you explain that one, Ernest, please? Thank you. Move to full board.
Motion to approve.
Second, Hall.
Thank you.
Yeah, this one, of course, one of our largest programs and one I can't talk enough about is our Head Start program. It does so much, not just for our children, but for our families. And we'd be glad to give the board a presentation on all that Head Start does. We do so many good things with the Head Start program. Of course, it's a large program. You can see that we're at about 14.7 million. So this 300,000 is another one of those incremental distributions that came from our federal funders. We didn't have to apply for it. They let us know that there is additional money for coronavirus response. One of the things that we have been challenged with this past year is warehouse space. I don't know how many of you have been over to Central Receiving on Vic Woods Drive, but it is packed up to the gills, to the ceiling, pallets upon pallets, as many as are safely able to be stored there. And the same with our food program warehouse. We used to have some space there for different types of stuff, and now that's full. So one of the challenges we've had is finding storage space for our Head Start items. When you come over here to the Verkulen building and you see those storage pods out in the parking lot, that was part of our temporary solution. We have teachers coming over to the parking lot and using those moving containers to get some of their class goods to get out to the children and families. So this funding was very much needed. Even though we're a large program, having that constraint of not having warehouse space that we usually had and incurring additional costs for renting warehouse space, was an unplanned cost. One of those fallouts of the pandemic we didn't expect. So between that and some other items, we expect that this funding will really come in hand to make sure we continue to adapt our Head Start programs. And hopefully that means you're going to see those pods go away in the Verkulen building, and we'll secure some permanent warehouse space that we'll be able to use.
I see no speakers. We'll go for a vote. Thank you. While we're waiting, Ernest, I have to tell you, I noticed a couple white trucks with the county emblem on them near my home. And I looked out and I said, well, that's the MAC people. I know those are the MAC guys. So I walked over there, I put my mask on, I walked over and gave them each a card and I said, hello, how are you? And I said, I know who you work for and yada, yada. And they were outside working. And anyway, it was just nice to see them.
Oh, that's good to hear.
I was only there for a couple minutes. And
we're all over the community. One of the things we're working on with planning and economic development is a GIS map to show all of us how many places we reach in the county. If you were to put a dot on the map for every location we're at every day, it'd fill up the county. And we think that's an important story to tell and a compelling visual for everybody to understand, or how many programs are all over the county that the county provides. So I hope to be able to share that with you soon.
I had a warm feeling in my heart when I saw them. I knew that. Thank you very much.
Madam Chair, this is Commissioner Matuzik. Since we have Ernest here, may I ask him a question related to an item we discussed at a previous meeting?
Well, of course you can.
Well, you're in charge. I'm like doing my thing here. Yesterday, the court struck down the eviction moratorium, then reinstated a stay until they appeal this. If the eviction moratorium is tossed out, we're going to have a lot of families who may be in pretty dire straits. Is there a way to use some of this eviction moratorium money to assist folks who may get lost?
It's a great question. It's one we think a lot about. The most important thing for you to know on this topic is Michigan Supreme Court has already prevented it. Other states are at risk. The Michigan Supreme Court has issued guidance to all courts that no eviction can proceed to settlement if they have not applied to the SARA program. So right now in Michigan, if you're eligible for SARA, the Supreme Court has issued guidance to all courts that eviction cases may not proceed past pre-trial to settlement unless the client has applied to the SARA program if they're eligible. So right now we are working on that communication to realtor associations and landlords and property management groups around the county, because there was a lot of news yesterday saying the CDC moratorium has been struck down. Go collect those arrearages. In Michigan, that's not true. The Supreme Court made clear in no uncertain terms, courts cannot proceed to settlement after pre-trial for any eviction case if the tenant is eligible for the SARA funding and has applied for it. And if they have applied for it, they have a reasonable amount of time to secure that payment. So you should feel good that the Michigan Supreme Court already preemptively stepped in the other month and made that ruling. And we are working with both Lakeshore Legal Aid and other associations to make sure that the landlord and property management companies understand this. Right now, money spent on legal fees for rent arrearages, in my opinion, is money wasted. The judge is going to tell you one thing: I cannot proceed to settlement. I'm not arguing that Julie owes Ernest money for her arrearages. We're not debating that. Pre-trial showed that, but I cannot proceed to settlement until Julie has applied to the SARA program, because that is a remedy that is available to us and to you. So we are trying to get the word out about that. I saw a lot of misleading information coming out yesterday about the CDC and its implication for Michigan. But in Michigan, because the Supreme Court has issued that guidance to courts, we are also educating the judges on the circuit courts to make sure they are aware that that guideline is in place and the SARA program is easy to apply to.
That's very good news. I was worried we were going to have to undo all the things we did a couple of meetings ago and figure out how to reallocate that money. So thank you.
Mm-hmm.
Madam Chair, this is Commissioner Sabatini. I was having some connection issues there, and I did vote yes for E, F, and G. I don't know if they went through, but just note it for the record. Thank you.
Mike took care of that. Poor Mike is waiting to give us our most recent voting thing because we started talking.
Yes, and we did take care of correcting the record for Commissioner Sabatini, and so that last motion passes 13-0.
Thank you, Mike, very much. Sorry we had to bug you there.
Thank you.
Does anyone have any other things they want us to ask Ernest about? Because I think we're done bothering Ernest. Okay, otherwise, Ernest, thank you very much.
Thank you all.
Bye now. We have some correspondence, but we all have that in our packet, unless someone wants to speak about it.
Madam Chair, I make the motion to combine A, B, and C for receive and file.
Support.
Second, Bernard.
Thank you. Shall we vote on that?
That motion passes 13-0.
Thank you, Mike. We are now into new business. Does someone have something they want to bring up? I would say that I went to the Ministerial Alliance prayer time today in Mount Clemens. I didn't realize it was going to be outside. I should have realized that, but I was just barely warm enough. It was a very moving, very scripturally based event. Many pastors prayed, and they had two dynamic ladies that sang. I can't tell you how beautifully they sang. And it was a beautiful time, and there were lovely, lovely people there. It was just honestly, a wonderful time. I could go to tears now just thinking about it. Ran into Commissioner Matusik there, which was very nice, of course. Met several nice people there and visited a little bit before it got going. And I believe Harold was there, but he was spying on us because I didn't see him at all. So it was a very, very nice experience.
And yes, I was, Barb.
Harold likes to sit in the back of the church, so you know the probably noise and you didn't see him.
With my mask and sunglasses on, Joe.
I'll tell you, those masks, I can't recognize anybody. We are now going to public participation. Staff, do we have anybody on anywhere?
Chair, we do not appear to have anyone wishing to speak.
Is anyone there for public participation? Is anyone there for public participation? Okay. Well, then I guess we may have to say goodbye, and we're going to have to go to adjournment then. Is anyone going to make?
I make the motion for adjournment, Madam Chair.
Support.
All right, sorry to say yes, we will do that, and we have to vote on that, I guess. And then we'll have to say goodbye, and we'll see your lovely faces for a while. At least the weekend.
Happy Mother's Day to everybody, all the mothers.
Yes.
Great meeting, Barb.
Well, yes. I had some help again, and I just got out of my voting screen. I'm gonna have to vote. No, yes, we're leaving. Okay, goodbye.
Happy Mother's Day, all you ladies, and take care. We'll see you all next week. Take care. Goodbye. Good meeting, man.
Happy Mother's Day.
Thank you.
Thank you.